If you're over 60 and taking several medications every day, I want to help you avoid a problem I see constantly: pills that seem harmless but can silently affect your heart without you realizing it. I'm Dr. Gabriel Mena, cardiologist, and today I want to show you how to identify those risks and what you can start doing now to protect your health. What you're about to hear is exactly what I discuss with my own patients and my family. Welcome to my channel. Here we talk about heart health, longevity, and simple daily habits that help you maintain physical, mental, and emotional balance. Take notes and feel free to share this with your family and friends so they can improve their health too. We upload new videos every day, so make sure to subscribe and turn on all notifications. Before we continue, if you find this content valuable, something as simple as supporting or sharing the video helps this message reach more people who truly need it. Thank you for taking the time to be here and for taking care of your health. Now let's get into the topic. I want to share something personal. Not long ago, I went through my own medicine cabinet and removed 5 medications that, while very common, could have caused more harm than good. And I didn't remove them by mistake. I did it because I realized I needed to protect my health. That's exactly what I want you to be able to do, but with clarity and a plan, never out of fear. Every day in my practice, I meet people dealing with what I call a silent pandemic: polypharmacy. It simply means taking too many medications at the same time, especially after age 60. Many people take them with the best intentions: something for knee pain, something to sleep, something for allergies, without realizing that some of those pills may be putting extra pressure on their heart. Let me be clear, this is not a boring medical lecture. This is the same conversation I have with my parents, my uncles, my patients, and anyone I care about. What you'll hear today is the advice I give when I truly want someone to protect their health without fear or dangerous mistakes. We're going to talk about medications so common that you probably have at least one in your bathroom drawer. Pain relievers, sleeping pills, anxiety medications, products that seem harmless but, in a heart that has already beaten more than 2 billion times, can cause significant effects even if you've never had heart problems before. For example, an anti-inflammatory that barely affected your blood pressure at 30 can raise it dramatically at 60. A sleeping pill can increase your risk of falling, and a fall in an older adult can trigger serious heart complications. That's why we're not here to panic. We're here so you can make informed decisions. Knowledge gives you control. My goal is that by the end of this content, you'll know exactly which medications you should review, what safer alternatives exist, and how to talk to your doctor without fear or confrontation. That's essential. Never, under any circumstances, stop, reduce, or change a medication on your own. Some treatments can become dangerous if stopped abruptly. What I'm sharing is meant to give you clarity so you can have a productive conversation with the professional who knows your medical history. I want you to stay with me if you're over 60 or if you take care of someone who is. Let's review that medicine cabinet together to make sure everything you're taking is helping you, not adding risks you don't need. Let's start with the first category of medications. I'm almost certain you or someone close to you has at least one of these at home: non-steroidal anti-inflammatory drugs, known as NSAIDs. I'm talking about very common pills like ibuprofen, naproxen, or diclofenac. They're used for almost everything: headaches, back pain, arthritis, muscle discomfort. They're effective and easy to get, which is exactly why they can become risky if used without caution, especially after age 60. Why are they a problem for the heart? Imagine your arteries as a system of pipes and your heart as the pump that pushes the water through. Over the years, those pipes become stiffer and pressure rises. That's hypertension. When you take NSAIDs, you block substances that help keep blood vessels open. They also cause your kidneys to retain more salt and water. It's a double hit. The vessels narrow and the volume of fluid increases. Your heart has to work much harder. If you take them occasionally, the impact is small, but if you use them daily for arthritis pain, that increased pressure becomes constant. Over the years, I've seen how that constant strain weakens the heart. I've had patients who, after months of taking NSAIDs every day, developed heart failure or suffered heart attacks or strokes. And this isn't theory. I remember a patient named Clara, 68, who took ibuprofen daily because her hands hurt. She couldn't understand why her blood pressure was always high until we reviewed her routine. Once she stopped the NSAID and we found safer alternatives, her pressure started normalizing within days. So what can you do? It's not about enduring pain. There are much gentler options for your heart. For mild to moderate discomfort, acetaminophen is usually safer because it doesn't raise blood pressure or cause fluid retention. There are also topical treatments, gels or anti-inflammatory creams, that work directly where it hurts without affecting your entire body. And don't overlook the basics: heat to relax muscles and cold to reduce inflammation. For chronic conditions like arthritis, what helps most long-term is staying active, physical therapy, gentle exercises, swimming, or even daily walking. A diet high in omega-3s and natural anti-inflammatory foods like turmeric or ginger can also make a real difference. If you ever need an NSAID, use it wisely, the lowest dose for the shortest amount of time, and never combine different NSAIDs. Always consult your doctor to create a plan that doesn't rely heavily on these medications. Now let's move on to the second category of medications, also very common and often carrying hidden risks. I'm talking about drugs used for anxiety, insomnia, and muscle tension, benzodiazepines, like alprazolam, clonazepam, lorazepam, or diazepam. These medications calm and relax the body, but in older adults they increase the risk of falls, slowed reaction time, confusion, and even cognitive decline. And this can indirectly put a serious burden on the heart. In a moment, I'll explain in detail why this happens and what safer alternatives you can consider. If you're over 60 and use pills to sleep or calm your nerves, I want to help you avoid one of the most serious risks I see every day in older adults: falls and their consequences for the heart. Many of these accidents begin with a pill that seems harmless. That's why today I want you to understand how to prevent this and what safer alternatives can help you sleep better and manage anxiety without putting your health at risk. In the hospital, I see situations that truly break your heart. One of them is Elena, 75. She took a small dose of a sleeping medication every night. One early morning, she got up half asleep to go to the bathroom, lost her balance, fell, and ended up with a hip fracture. As a cardiologist, I can tell you, in an older adult, a fracture is not just a broken bone. It's surgery, long periods in bed, blood clot risks, infections, and enormous stress on the heart. Many heart attacks in the elderly don't happen at home. They happen in a hospital bed as a consequence of a fall triggered by a pill meant to help with sleep. And that's not all. When benzodiazepines are used long-term in older adults, they can affect memory, focus, and mental clarity. I remember Carlos, 80, whose family feared he was developing severe cognitive decline. He had been taking an anxiety medication for years. He was slow, quiet, forgetful. I suggested a very gradual, supervised tapering plan. It took months, but the change was remarkable. He became more alert, more talkative, more cheerful. It wasn't dementia. It was the accumulated effect of a medication he had taken for too long. The good news is that there are safe ways to treat anxiety and insomnia without shutting down your brain or putting you at risk. Cognitive behavioral therapy, especially for insomnia, is incredibly effective. It doesn't sedate you. It teaches you to retrain your sleep habits and manage the worries that keep you awake. And long-term, it works better than any pill. Another key factor is sleep hygiene. Creating a calm environment, avoiding screens an hour before bed, keeping regular sleep schedules, and reducing caffeine or alcohol in the afternoon can make a huge difference. Relaxation techniques, deep breathing, meditation, or gentle stretching before bed are also powerful tools. With just 10 or 15 minutes a day, your mind can calm down more naturally and safely. Exercise is also a powerful ally. A morning walk with sunlight helps regulate your biological clock, making it easier to sleep better at night. And if your anxiety is intense, there are safer medications for your age. Some antidepressants, when used at the right dose, can help without causing the kind of drowsiness that increases the risk of falls. For sleep, melatonin or certain medications at very low doses can be helpful, always under medical supervision. My own mother had trouble sleeping, and I asked her not to keep benzodiazepines at home. We installed a meditation app and adopted a no screens for 1 hour rule. At first it was difficult for her, but now she sleeps better and most importantly, stays more alert during the day. Changes like these, even if they seem small, can transform your life. If you are using any of these medications, I recommend talking to your doctor about creating a slow and safe tapering plan. They should never be stopped abruptly. Now let's move on to the third category of medications I removed from my imaginary medicine cabinet: tricyclic antidepressants. Although they are older, they are still prescribed for chronic pain, migraines, and nerve discomfort. Amitriptyline is the best-known example. And while it can relieve pain, in older adults it may affect the heart's electrical system, something we must take seriously. Imagine your heart works like an orchestra. Each heartbeat is an electrical impulse that follows a precise order. Part of that process is called the QT interval, which is the time the heart needs to recover before beating again. Amitriptyline can alter that rhythm and throw the orchestra out of sync. In a younger person it might not cause problems, but in an older heart, that change can trigger dangerous arrhythmias, fainting, or even sudden cardiac events. This medication can also cause dizziness, blurred vision, and sudden drops in blood pressure when standing up, which again increases the risk of falls. I remember a case from my residency. A 68-year-old man with diabetes arrived at the emergency room nearly fainting. He had been taking amitriptyline for 2 weeks for foot pain. His ECG showed such a prolonged QT interval that we had to admit him immediately. He recovered, but the medication that relieved his pain had nearly caused a life-threatening arrhythmia. Fortunately, today we have safer alternatives. For depression or anxiety, modern antidepressants like sertraline or citalopram are much safer for the heart. For nerve pain, medications such as gabapentin or pregabalin usually work well without affecting the heart's rhythm. And for migraines, there are options ranging from beta blockers to newer medications your doctor can consider with you. Recently, a relative of mine was prescribed amitriptyline for nerve pain. I recommended talking to the doctor about starting with gabapentin instead, which is safer for her age. The doctor completely agreed. If you are taking amitriptyline and notice dizziness, palpitations, or confusion, talk to your doctor as soon as possible. There is likely a more modern and more suitable option for you. Now let's move to the fourth category of medications. Many people consider them harmless because they are used for allergies, colds, or even sleep. I am referring to first-generation antihistamines such as diphenhydramine, found in many well-known brands. There's also dimenhydrinate, used for motion sickness. Yes, they are effective, but the drowsiness they produce, and that some people seek, is a major concern for older adults. These antihistamines are strongly anticholinergic, meaning they block a substance essential for memory, focus, and heart rhythm. This partial shutdown of the brain causes confusion, sedation, and blurred vision, which greatly increases the risk of falls. And as we know, a fall can lead to complications that affect the heart and overall health. They can also cause rapid heart rate and arrhythmias, something an older heart should not have to handle because of a simple allergy pill. In the next section, I will explain how to protect yourself and which alternatives are truly safe for you. If you want to protect your heart and avoid unnecessary complications from the medications you use daily, this next part of the video is essential. It will help you make safer decisions and guide you on how to talk to your doctor with confidence. We'll continue reviewing medications that may cause problems after age 60 and, most importantly, how to find alternatives that support your health. A moment ago I shared the case of a close family member, and now I want to remind you that many older adults go through similar situations without realizing the true source of their symptoms. I've also treated patients like a 74-year-old woman who came in with dizziness and confusion. When we reviewed her medications, we found she was taking one of these older antihistamines. Once we switched it to a modern option, her clarity returned within a few weeks. Simple changes like this can completely improve your well-being. Today we have much safer medications. Antihistamines such as loratadine, cetirizine, or fexofenadine are designed to relieve allergies without entering the brain, avoiding excessive drowsiness, confusion, and heart-related risks. They perform the same job without clouding your mind. And remember, using an old antihistamine just because it makes you sleepy is not a solution for insomnia. That type of sleep is light and fragmented and does not restore you. Returning to healthy habits, relaxation techniques, or professional recommendations is always the best path. For motion sickness, aside from dimenhydrinate, there are alternatives that can be evaluated carefully, such as certain patches or even natural options like ginger. But what matters most is medical guidance. This is also advice I give my own family. At home, we all check active ingredients. I taught my parents to identify diphenhydramine in sleep products and to avoid it completely. My father, for example, manages his allergies with loratadine. He gets relief without putting his mind or balance at risk. Do the same with your medicine cabinet. You'll be surprised how often that ingredient appears. Now we reach the final medication on the list, and it may be the most surprising. These are certain blood pressure medications, not all of them, only the very fast-acting ones, such as immediate-release nifedipine. It may seem logical that if your blood pressure is high, lowering it quickly would be good. But it's actually the opposite. Dropping it suddenly is like opening a dam all at once. An older person's body cannot adjust fast enough, leading to intense dizziness, fainting, and a high risk of falls, fractures, and hospitalizations. That sudden drop can also trigger a rebound effect. The body releases stress hormones that speed up the heart, and in someone with fragile arteries, this can lead to chest pain or even a cardiac event. That is why these fast-acting medications are rarely recommended today, yet I still find them in medicine cabinets as emergency pills, something extremely risky. Modern alternatives provide steady and gentle control. Long-acting blood pressure medications release their effect slowly throughout the day. Amlodipine, ramipril, losartan, all are designed to keep blood pressure stable without dramatic swings. And here's a practical tip. Keep a home blood pressure monitor, but not to self-medicate. Use it to record trends your doctor can interpret. What matters is the pattern, not a single reading. Another simple and very effective recommendation: do not get up abruptly. Sit at the edge of the bed, move your feet, and stand up slowly. This few-second pause prevents many dizzy spells and falls. And if you find soft gel nifedipine capsules in your medicine cabinet, ask your doctor why they're there. There is almost always a safer option for you today. Now that we've reached this point, I want you to understand clearly that the goal is not to create fear, but to bring clarity. We have reviewed 5 types of medications that can complicate heart health after age 60. I do this because I truly believe that information is a form of care. You have more power than you think to protect yourself. Next comes a key part: how to talk to your doctor. This is not about stopping anything on your own, but about starting an honest conversation. Many people struggle to speak up, but I say this sincerely. A patient who participates, asks questions, and seeks to understand always makes better decisions. Before your appointment, put everything you take into a bag: vitamins, drops, creams, prescription, and over-the-counter medications. In medicine, we call this the brown bag review, and it's incredibly valuable. When you talk to your doctor, avoid starting by saying you watched a video that discourages a certain medication. That can create unnecessary tension. Instead, make your doctor your ally. You can say something like, "Doctor, I'd like us to review my medications to make sure everything I'm taking is still the best option for me." Ask questions, not accusations. "I've been using ibuprofen almost daily and I'm worried about how it affects my blood pressure. Are there safer options for my heart?" Or, "This sleep medication leaves me dizzy in the mornings. Could we consider alternatives that don't involve medication?" Also share what you value most in your life. Many of my patients tell me they want to stay active, play with their grandchildren, or keep their mind sharp. These goals help guide what is truly necessary. Doctors know the science, but you know your body. The best decisions are always made as a team. We've covered an important journey through your medicine cabinet and your health. And if this content has helped you, I want to ask you for something meaningful. Share this information with someone who needs it. Maybe your mother, your brother, your best friend, or your neighbor. A single message can open a conversation that may save a life or improve it tremendously. Before we end, I want to invite you to subscribe to the channel, turn on notifications, leave a comment, and share this video. We upload content every day to help you take care of your heart and your well-being with clarity and kindness. Join us, because your health deserves daily attention. I also want us to take a moment to give thanks for life, for each day we can learn, and for the opportunity to gain knowledge that helps us take better care of ourselves. Gratitude is also part of the path to good health. Thank you for your time and for sharing this space with me. Here on Dr. Gabriel Mena's channel, we are truly grateful to accompany you, provide helpful information, and support you in improving your habits. Tomorrow we will have a new video, prepared with the same dedication so we can continue growing together. I invite you to watch it. I'm sure it will be very helpful to you. Take care of your heart. It is the only one you have.